One of the most confusing moments for families in the ICU is this. The prognosis sounds serious. Complications are increasing. The medical team is concerned, and yet treatment is still being offered. Another medication, another procedure, another escalation. So families understandably ask, if the doctors are still offering treatment, does that mean there's still a real chance? This is where clarity matters. In medicine, offering an intervention does not automatically mean it is recommended in the way families often interpret it. There are several reasons treatment may continue to be offered, even when prognosis is poor. First, medicine is built around possibility. If something can be done technically, it is often presented as an option. Second, physicians are trained to avoid prematurely limiting choices, especially in critical care. The culture leans towards action. Third, prognosis is rarely delivered as absolute certainty. There is often a range of outcome, even when the overall picture is concerning. So treatment continues to be available, but availability is not the same as alignment. This is where caregivers can feel caught because emotionally, offering feels like hope. If something is still on the table, it can feel like walking away would be giving up too soon. But the key question often goes unspoken. If we continue this intervention, what outcome are we realistically hoping for? And does that outcome match what the patient valued? Doctors may continue offering treatment because it is technically possible, but only the patient's values can determine whether it is appropriate. This is not about accusing clinicians of doing too much. It is about understanding how medical systems function. In critical care, escalation is often the default unless a clear decision is made otherwise. That default is not malicious, it is structural, which means clarity has to be intentional. When treatment is offered, families can gently ask, is this intervention likely to change the overall trajectory? If it works as hoped, what would recovery realistically look like? If it does not work, what happens next? These questions are not confrontational, they are grounding. They help separate possibility from probability, and they allow decisions to return to alignment. In this series, we have talked about advanced directive, emotional resistance, and choosing the right surrogates. This final piece brings it together. Autonomy guides decisions. Emotions deserves space. And medical possibility does not automatically equal value alignment. When families understand how the systems operate, they are better equipped to ask clearer questions and make steadier decisions. Clarity reduces chaos. And in serious illness care, clarity protects everyone.